Is Medicaid able to cover all prescriptions? Medicaid is a federally funded health care program for low-income people and families. It provides coverage for a wide range of medical services, including prescription drugs. Medicaid does not, however, cover all prescription drugs. The precise drugs that are covered vary by state. Medicaid frequently covers prescription medications deemed medically necessary. This implies that the drugs must be used to treat a medical ailment that has been identified. Some drugs used for prevention, such as immunizations, are also covered by Medicaid. Is Medicaid going to cover compounded prescriptions? Compounded prescriptions are medications that are tailored to a patient's unique requirements. They are frequently recommended when a generic drug is unavailable or when a patient requires a different dosage or type of medication. Medicaid covers some compounded prescriptions. However, the precise drugs covered differ from state to state. It is critical to inquire with your state's Medicaid program to determine whether compounded prescriptions are covered. Is Medicaid able to cover 90-day prescriptions? Prescriptions for 90 days may not usually qualify for Medicaid coverage. Medicaid may only cover a 30-day supply of a drug in specific situations. There are, however, certain exceptions to this rule. Medicaid, for example, may cover a 90-day supply of a drug if the patient has a chronic disease that necessitates the drug's long-term use. Does Medicaid cover alternative medicine? Medicaid does not cover all complementary and alternative medicine therapies. However, some alternative medical therapies, such as acupuncture and chiropractic therapy, are covered. The particular therapies covered under alternative medicine differ by state. What medications does Medicaid not cover? Medicaid does not cover a variety of prescription medications. Among these medications are medications that are not deemed medically required, pharmaceuticals used for cosmetic reasons, drugs used to help people lose weight, drugs that Medicaid does not cover. A Medicaid formulary is a list of drugs covered by the program. The formulary differs from one state to the next. How many prescriptions does Medicaid cover each month? The number of prescriptions covered by Medicaid each month varies by state. In general, Medicaid covers a limited number of prescriptions each month, and patients may be required to pay a copayment for each prescription. In the United States, does Medicaid cover prescriptions? In the United States, Medicaid does not cover prescription drugs. However, the precise drugs covered and the cost of the prescriptions differ by state. If you are unclear if a particular prescription is covered by Medicaid, you can contact your state's Medicaid program. They will be able to tell you if your prescription is covered and how much it will cost. Medicaid provides coverage for a large range of prescription drugs. However, not all drugs are covered. The precise drugs that are covered vary by state. To find out if a certain prescription is covered, contact your state's Medicaid program.